The state's largest hospital in the middle of the largest city is continuing efforts to improve health care in the smallest parts of the state.
THV11's Frederick Price joins us with how UAMS is addressing an issue that's so familiar to a lot of Arkansans. Frederick?
Rolling, Marlisa, doing research in rural areas of the state is both costly and challenging. That's why UAMS is hopeful the $19 million they received today will bring light to issues of cancer and heart disease in under-resourced communities.
So from a community perspective, we are trying to reach people where they are in the community setting.
For years, Dr. Pebbles Fagan has tried to find ways to address health issues in rural and minority communities. And after not having much success, she says it's time for a more personal approach.
If you do something over and over again and you get the same results, then you have to shift your focus.
She and a team of researchers are now focusing on what resources they can provide to prevent diseases that primarily affect the people that live in these communities.
The two number one killers in our state, both cancer and cardiovascular disease. We hope to see that more people are trained to do this kind of research in our communities.
Their team will begin to tackle 3 different projects. Their first is helping Black Americans put down the cigarettes.
We do that through what we call evidence-based practice, which is using motivational counseling that encourages them to quit smoking.
Additionally, Fagan says the researchers will be going out into rural towns, visiting barbershops and schools. It's an approach that doesn't happen often, but she believes research done out of the office and in these towns will allow for better and more accurate results.
And we have another program that's focused on reducing alcohol use, which is another major risk factor for cancer and cardiovascular disease, and working in the barbershop setting where we know we can reach African American men.
Fagan adds that many people in rural towns don't have access to get health care. But with this community-based research, she's hopeful that will change.
What we hope to see at the end of the 5 years, that we have made some difference in preventing cancers, seeing cancer rates come down, seeing cardiovascular disease come down.
And once the 5-year grant is over, Fagan says the hospital will apply for additional funding. They are hoping to expand telemedicine programs in these communities as well.